I have one for Jane while people are thinking. Jane, you talked about having a parallel process, the Montreal Urban Ecology Centre, to the city's process, and I'm kind of curious how the city staff felt about that.
Okay, yes. Well, the first meeting that we had with city government about the project was we told them what our vision was, sort of a green, active, healthy neighborhood. And the woman she's head of urban design of this particular unit of city government, she just looked at me, she said, "I so admire your liberty." So we found, and that sort of capsulized the way why we developed such a good, although at times very tense, collaboration. And that is that we could push the envelope in terms of policy. And that the city had to be so careful not to do anything that was outside of anything that was already within the scope of their policy. But what they could do is, when we were pushing in one area, staff was on board with us. They just couldn't act because it was outside of what was in their policy. They could go back to decision makers and say, well, the Urban Ecology Centre is doing this, can we push a little bit too? And so there was some back and forth like that. And like I said, we had credibility because of our past experience, but also since we weren't funded by the city, they couldn't really control, they couldn't say, well, you can't do that. So they could say we won't implement it, of course, but they couldn't tell us not to. So it turned out to be very productive in that way, and also it was respectful most of the time. Effective to some extent. I mean, we have a long way to go. It's an ongoing process.
Other questions?
For the public health side of things, it sort of seemed like you have a responsibility to work with your internal departments to implement things that come out of this project. How do you foresee that playing out?
Well, we are already working in collaboration with and consultation with partners in transportation services. We made an effort all the way along to share our vision for community engagement in particular, and to be respectful of their internal processes and constraints, and our need to learn about how those processes work. So that's a process that's already ongoing, and we try to select communities based on community drive. So, for example, these two are ones where the community or a key stakeholder in the community has put something forward. But we also selected some based on the priorities of internal partners, the kinds of projects that they're interested in implementing, or projects where they feel public health voice or support would be helpful. And so we're hoping that those will also go a long way towards supporting their work, so that we're seen as a contributor to the changes that they want to make, rather than piling on with new demands. But there will be a tension between those sort of community-driven ones and the more municipally driven ones, we expect. But it's going to be a challenge going forward, but that we're making an effort from the get-go. We are mandated by the Board of Health to work together.
I think we have time for one more question. No? Then, okay.
I'm thinking from the actual point of view. So what kind of timeline would we see before, say, a community could come forward, just from the community itself and say, oh, we would really love to implement a slow zone in our area, and be able to go to the city, and the city would have a process that they could go through? Like, are we talking like many years, or is it something fairly soon, or?
Well, there are existing processes for people to participate in that planning process, and that's part of what public health, this project is a way for us to learn about what those are. And we can't commit our other city partners to changing those processes or developing other kinds of processes, but what we can do is try it out. And that's what we're doing here. We're going to try it out. We're going to see how it works. We're going to see what seems to work for us in the kinds of projects that we're interested in. We're going to see if and how it affects people's willingness to participate, their feelings of health and safety in their community, and so on. These are demonstrations. They don't necessarily lead to a particular future project, although they may. We will be reporting back, we hope, next year with some findings from the communities about the kinds of interventions they'd like to see, policy-wise and also in terms of physical and capital interventions. But we can't, as public health, we can't make commitments in that regard, but we can make recommendations, and we hope to be able to do that.
Can I make one last comment? Just because I also want to invite anyone to talk with me about it if they have advice. Also in response, I wanted to just mention one last thing, and that is, for us, one of the greatest sticking points with respect to our work in working with the city is on arterial roads. So the city government really wanted to restrict as much as possible its interventions to more residential streets, sometimes collectors, and we insisted that this also, for us, our project, it has to include arterial streets. They're also mixed-use streets, and for us it was essential, and that was a real sticking point. So if any of you happen to work with local government or have any suggestions in this regard, I'll be here, and I'd love to hear what experiences you've had doing these kinds of complete streets approaches on arterials.
There's a keynote presentation starting at 3:30, so I think what we do is we'll thank them right now, and if people want to stay and talk to them individually afterwards,